Today marks 5 years since the World Health Organization officially declared COVID a pandemic.
Yeah, that decision was made after there were more than 118,000 cases in 114 countries. 2 days later, the first Trump administration declared a nationwide emergency and issued a travel ban due to COVID-19. North Carolina saw more than 3.5 million cases alone.
The global emergency status was eventually ended due to COVID back on May 5th in 2023. More than 1 million people died collectively from COVID just within the United States.
We're joined now with VP of Science at Maddox, Alistair Campbell. Alistair, thank you for joining us from the UK.
Great, thanks for having me.
We want to start here. Obviously, COVID 5 years ago, we were just talking about it. It seems like yesterday at some point, seems like 10 years ago at others, but we learned so much, mainly because we were forced to act quickly because we had a global pandemic. How did that force research to kind of move at breakneck speed?
I think it was an amazing experience as researchers realized what could be done if we really collaborated in a different way. So researchers across the world had to act, they had to share data, and they had to really make quick decisions that actually had a huge impact on patients. So it's really shown us what can be done, and it's helped us sort of really reposition what we can do going forward to help patients.
So when you talk about having to work more together, obviously, I'm not a scientist, but I would just think that there are loads and loads of data and numbers when you're trying to come up with a new drug or trying to study a certain virus that's out there. So is it the introduction of AI? Is it just using it differently like the rest of us are in our own industries, where it's able to help you process what's out there to spend more time on viewing the results? Like, help us understand on a layman's term how this has really transformed the way that you research.
So AI has been around in research for a long time. It's not a new thing in research, but what has become really apparent is the need for really high quality data. And then what we've seen is this huge transition with much better computing power, where we can actually start to analyze huge swathes of data much, much faster than we ever could. COVID showed us what that could mean. It meant that we could analyze the structure of the virus quicker. It meant that sort of a really great example is how Moderna used it to help them develop their mRNA virus, their treatment vaccine. So it really helped across the industry. It's how we analyze data quickly, how we correlate data, and how we can actually use it going forward to make sure that the right patients get the right treatment.
Alistair, this kind of shocked me going through the data here. It, on average, used to take a drug to get to market over a decade with a 90% failure rate in clinical trials there. So how has AI kind of cut down that time to just say, okay, this works, this doesn't? How's it work?
So AI has been used across that whole process. That 10 years broken down into many different phases, from research through to the different clinical trial phases. So it's really helping in that initial discovery phase. So drug companies are able to discover new candidates faster. They can use AI to use predictive AI to help them design, have an algorithm tell the scientist what it thinks could be the right drug for the right patient. And then it allows us to also look further down the clinical trial chain. How can we find the right patients to test the drug in? We know that a lot of different diseases are not just a one size fits all type disease. We really have to find tailored precision medicine. So AI allows us to crunch those really complicated numbers on the patient per patient basis so that we can match up the right patient to the right treatment, and we can do that all in a much shorter period of time. So we want to see reducing that 10-year time down into a couple of years. We want to take that $2 billion that cost of getting there. We want to see that down into the hundreds of millions.
Alistair, as a scientist, as a researcher, as you look into the future for the next 10 years, man, technology and AI moves so quickly. And as you mentioned, you've been using it in science and research for years. But what excites you about the future of medicine, of research, of drug discoveries, that you're just at the tip of going through and of discovering, you and other scientists, that most of the public doesn't even know about? What excites you looking ahead?
I think that's actually the point I get. So I'm super excited about this idea. We really are only at the tip of the iceberg just now of what AI can do for us. So I think we're going to see over the next years a real rapid evolution of how we can use it to identify new treatments. And actually, what that means is our loved ones, our friends, our families are going to get treatments and medicines to them that are really going to make life-changing effects, and they're going to get them faster than ever before, and we're going to be able to help far more people across the globe. So I think AI is going to be a real tool in the armory of the scientists to enable them to do that.
And Alistair, real quick, we talk about AI and how quickly it moves and how much it can help, but also one of the things you talk about is that humans are necessary. It's not like AI is going to do all the jobs. So what role do humans play in all of this?
So humans are there as the curators of the data. Humans have to design the algorithms, but we also have to make sure that we provide the right data to AI to make sure it's not hallucinating. We need the AI to be able to give us back an answer that we trust and we can believe in. So this human part of that is really making sure we get the right high quality data, and then we interpret the results with the right level of scientific rigor so that we can take forward something that we truly believe is going to help the human population.
And then, Alistair, I would rather communicate with you as a human instead of an AI when it comes to interpreting what you've discovered, the human side of that, which includes feeling and emotion. So, Alistair Campbell, a scientist with Dotmatics in the UK, thank you for your time, the discoveries that you guys have already made, and what you're working for the next 5 or 10 years. It is exciting to watch. Thanks for your time.
Thanks so much.